you want to speak, it's one click up, just like that. So let's go ahead and begin our August 24th meeting of the El Paso County Public Health Board of Health. And welcome everyone this morning on this beautiful Colorado Bluebird Day. And thanks for coming. We'll begin with the board member roll call. And I'm here. And Doris, I want to thank you for chairing our last meeting at the end of June. And so thank you very much. Commissioner Bremer, I see you over there.
Present.
Commissioner Gonzalez, you remote? Hey, how you doing? Councilmember Dave Donaldson.
Here.
Dr. Vu. Calling Dr. Vu. He may show up in a minute. Fire Chief Ted Colas.
Here.
Okay. Trustee Ron Stevens.
Here.
And General Jack Briggs is absent, but he's presenting at a national conference today and on the subject of how to avoid organizational mission creep, which is a military term, but I think we'll perhaps get to hear that afterwards through a link. Okay, we have the agenda in front of you, board members. You've had a chance to take a look at that. Motion to approve?
So moved.
Second? All in favor?
Aye.
Okay, well, this is the time where we get to have comments from Board of Health. Oh, pardon? Introductions? Yes, we have some special guests here today, and this is as good a time as any to do it. Director Whelan, if you want to go ahead and introduce some of our special guests.
I'd like
Yeah.
to introduce some additional team members to our agency, and we have done some public notifications as well. And I'd like some of our new team members to come up if they are in person. And I know that we have one of our co-medical directors online. So we'll go ahead and start with Dr. Paul Mayer, who we are thrilled that he has accepted a role with us to be a co-medical director. And I would like you to come up and say a little bit about your experience and introduce yourself.
Thank you very much.
One click forward, I think we need.
Thank you very much. My name is Paul Mayer. I've been a family doctor for about 30 years and started out in Durango, general family medicine, obstetrics. Moved from that into community health and did community health for many years, including HIV work. Then about a year and a half ago, I became the medical officer for Larimer County Department of Public Health and enjoyed that a great deal. I have a close association with Chris Urbina, who's been a wonderful help to me as I've entered the realm of public health. And so he made me aware of this position. So I was very excited to apply and then be accepted. I'm very glad to join you all here. I'll mention one of the I was very interested, as Chris mentioned, what an amazingly strong team you all have. And I've been here just a short period of time, but I'd have to say that's for sure true. Everybody I've met has been great, super helpful, super competent. I'm very excited to join.
Well, let me express on behalf of the whole board how welcome you are and how much we appreciate that you would come and work with us here. We look forward to working with you in the future and getting to know you better. You also know a good friend of ours, Tom Gonzalez.
I
there.
indeed know Tom Gonzalez.
Yeah. So, of course, we got a great history with Tom. So thank you very much.
Yeah, he's been a great boss as well. Thank you. Thank you
Thank
very
you.
much.
We have Dr. Vu in attendance too. Just wanted to note that. And Dr. Bernadette Albanese, I'm not sure that she's online. She's going to be doing a presentation later, but I know that she had another commitment early in the morning. Unless you chime in, Dr. Albanese, and we'll get to you a little bit later.
No, Dr. Albanese.
We have a new full-time environmental health division director, Roy Kroger, and he has started with us this week full-time. He has been working part-time as our environmental health division director, and we are again very excited to have him join our team. Roy, if you could introduce yourself, please.
Thank you, Susan. Through you, Mr. Chairman. My name's Roy Kruger. I've been doing environmental health for 29 years. The entire time was in Cheyenne, Wyoming. I am a Colorado State graduate from the environmental health program up there. And like you said earlier, Tom Gonzalez is a great friend of mine as well. I've known Tom since we went to college together. And so I look forward to being in Colorado Springs again. I lived here twice in my life previously. Once when I was a child, my dad was stationed at Pete Field, and I was stationed myself at Fort Carson. So I'm familiar with the city, even though it has grown a lot in the last 30 years since I was last here. And so I'm looking forward to working with a great set of team members, both from the administration side and from the environmental health side. So thank you.
Well, thank you also. And it sounds like from your history, you're almost a native, about as close as we can get. And your particular position, environmental health director, has been long awaited, much needed. And I wanted to thank you. We really look forward to your expertise and getting to know you better.
Thank you, Mr. Chairman.
Yeah.
And those are
Those are the
the
three
staffing
that we're going to introduce. Okay. Any elected officials here that we might want to introduce? No. Okay. Board of Health member comments. We can go ahead and go around, and I'll go last. Hello. Hi. How are you? Welcome back, Lori. I didn't expect to see you. Commissioner Bremer, any comments?
I have none this month, thanks.
Okay. Councilmember Dave Donaldson.
Thank you, Mr. President, and no comments for me. I'd simply like to express my greetings to Dr. Meyer and Mr. Roy Kroger. Welcome. Look forward to working with you.
Great.
No comment, thank you.
no comment.
Okay. On this side?
Yeah, I'd like to thank Dr. Urbina for his service to us.
Yes.
You know, as an interim, he was here for quite a while and
Yeah.
was very present in our meetings, and appreciate his time and energy. And I would just like to just say publicly that we are joining in the grief of Deputy Andrew Peary, and it was just a tragedy for our community, and we're keeping his family in our thoughts and prayers.
Thank you. Thank you for that. Right? No? And let's see, virtually, Commissioner Gonzalez. No? Anybody else we're missing? Okay, great. Very quickly, I'll just comment on something that was in the Gazette today, well, yesterday, and frequently in the news, and that is the concept that is increasingly important, and you'll hear about it today, which is the concept of One Health, which is that diseases in the animal kingdom affect human health. And there's quite a bit of science behind this and plenty of experience. And you can think back about some of the most horrific diseases in human history, probably originated in animals. We'll hear about monkeypox today, but we'll also hear about some other diseases. Avian influenza, a form of which is infectious for humans, not this one, has wiped out about 20% of the chicken population in Colorado right now. So if you're a chicken farmer or have backyard chickens, this is especially important, but it affects all of us. And that is one of the diseases, not that variety, but that can leap over. So I think we will hear about monkeypox today, which I'm excited about. And also in the future, we'll hear more examples of One Health. So there's the Science Minute this morning. Speaking of minutes, I think we need to approve the minutes. They're in front of you. If you take a look, I'd entertain a motion to approve.
So moved.
Second?
Second.
All in favor?
Aye.
I don't know if there are any members of the public here that wish to make a comment. But yes, okay, please come on up and introduce yourself. And if you're associated with an organization, I see you're wearing a lapel pin, so that might be the case.
I'm
And-
actually not with an organization.
Oh, okay.
I'm
And-
here for myself. So, good morning. My name is Stephen Walsh. I'm a resident of El Paso County. I have 2 points I really want to make this morning. The first one is as we roll into, I don't know anybody excited to hear about monkeypox, but that's my first point. So as we roll into the next public health emergency, I think it's very important that we as a community don't operate out of a spirit of fear, okay? So as you're probably aware, the pictures that we see floating around of monkeypox are actually shingles, okay? And then as I went through and I looked of previous listed side effects of the COVID vaccines, some of that was autoimmune blistering disease, as well as shingles were listed side effects. So as a citizen, I know as we roll into this and as we start seeing data get presented, what I want to see is I want to see if any of those people that are positive cases have in fact received any COVID vaccine, because I want to be able to make my own informed decision as well as have the community make their own informed decision based on the best available data. Okay. My second point is every other facet of society is operating without wearing face masks. Okay, we've moved on, we're normal. It's time for the healthcare facilities to follow suit. To me, it's a fool's errand to continue to operate under false assumptions with no perceived benefit. When the State Board of Health voted in July not to require vaccines for healthcare workers, the facilities dropped that requirement almost immediately. And it's time for that guidance to require masks in healthcare settings to get readdressed as well. It is important to improve credibility that we all suffered during COVID, okay? And part of that is not waiting for someone else to give us permission to make the right decision. So please take a look at that and see if every other piece of society is without masks, then maybe we can look at the healthcare facilities. And I'm happy to answer any questions if you have them.
All right, thank you for your time. All right. We have some public health champions here. And Director Whelan, do you want to go ahead and introduce them?
Yes, please. If I could call upon Stella Hodgkins to come up, please. So as you know, we take the time to recognize public health champions at many of our different meetings. We cannot do our job in serving the public in a silo, and so we continuously reach out to various different partners, different sectors, whether it's multidisciplinary organizations or even concerned citizens or leaders in the community that want to get involved and get engaged. So I met Stella in 2018 as part of the Center for Creative Leadership. It was a program with Colorado Springs Leadership Institute, and they selected 16 individuals to participate, and Stella was one of them. Back then, she was a corporate citizen leadership role with G.E. Johnson, and then currently she is serving as the I need to get this title right. Senior Vice President of Opportunity and Outreach at the El Palmar Foundation. In this role, Stella oversees El Palmar's Elevating Leadership Development Program, works closely with the ELD's Advisory Board and Advisory Councils from Colorado Springs to Pueblo. Stella has also co-chaired the ELD's Asian Pacific Islander Advisory Council and in her other volunteer capacities for ELD, including as member of the Milton E. Proby Selection Committee. And as a private citizen and as just a leader in the community, we are recognizing Stella Hodgkins as a public health champion for her initiative to get involved in the effort to provide accurate information, credible information, and also information beyond a one-size-fits-all. And so Stella took the initiative to pull numerous members of the community together, and we provided the expertise and the time, and it really was critical in helping us provide good information directly rather than relying on filtered sources of information. And so this helped build trust in the community. And and I'll talk a little bit about recognition that was received for the vaccine consortium, but we had numerous members of the community, and Stella was one of them that was heavily engaged, and this was over a long period of time. bringing people to the table and mobilizing in the response efforts. And so we want to commend and thank Stella for her initiative. And I know Stella will say that it's not necessary because she's involved in so many different efforts in the community to improve the community, whether it's health or other aspects. And so that's why she is being recognized today. And I would also ask any board members if they had any comments that they would like to share. I know that you all, many were part of the vaccine consortium and connected with Stella's efforts. And I'll also ask Stella to say a few words if she'd like.
Well, thank you. So first, I just want to thank the Board of Health for your support during this time. Director Whelan mobilized very quickly. And Director Whelan provided bi-weekly health and our leaders in our communities of color. It gave them accurate information. They were able to know exactly, one, what was going on with COVID and what some of the symptoms and things to look out for were, where to get vaccinations, where to get treatments if someone did come down with COVID. We were lucky enough to have Dr. Buck Patel in that group as well, and he ran a lot of the clinical trials for treatments in the city, and so he was also a trusted source that was able to help with that line of communication. In addition to that, Public Health provided a lot of marketing and communication support that was informed by that leadership in our communities of color, which I think is important because they were able to address what their specific needs were. And so Public Health provided marketing materials in the form of flyers and also videos that were translated in Spanish and 6 different Asian languages. And then we were able to help disseminate that information out to our communities. So thank you so much for your support. We don't have any empirical data in terms of how much this impacted our communities of color, but what we do know is that it did help build trust between public health and our communities of color, and it enabled accurate information getting out to our communities, which I think speaks for itself. Thank you.
Board member comments? Well, no? Yes? Yami? I'd like to say thank you.
Thank you as always. Both in your previous role and your current role, that took a tremendous amount of initiative for you to just personally decide that this was what you wanted to do with all your spare time. And so I am very grateful, and I'm grateful that that a community that could have been easily disenfranchised or not feeling like they were in the know had somebody like you to make sure they stayed in the know. So thank you.
Any other board member comments? Well, thank you, and thank you for all your contributions. And I think we have an award and perhaps a photo op. So, Michelle, do you want to organize that, please? Okay. Let's get her up here, and then we'll do that.
Okay.
Super good job. Got it? How about an applause for Stella? Thank you. Well done. Well, that's always nice. Next item on our agenda is finance and budget. And we have the July 2022 financial summary. Lori is here. Hello, welcome.
Is that, okay. Good morning, Board of Health members. Lori Clayton, County Budget Manager. And today I'm bringing forward the July financials for public health. So here I'll start with the revenue. And as you can see here, the program-specific grant revenue is continuing to come in significantly less to budget. This is primarily, excuse me, primarily due to the personnel vacancies that we've been seeing, and therefore less costs being billed to those grants. Because these are reimbursable grants, less costs being billed to those is resulting in less revenue coming in. For licenses, fees, and permits, that is now coming in really close to budget. In the prior months, there was a state system issue with the health space data system, and that was delaying a lot of the invoicing and receipt of the environmental health license and fee revenue. So that has since been fixed, and those revenues are coming in a lot closer to budget. For the expenditure side, we continue to see significant underspending, primarily in personnel, and that's kind of due to the staffing challenges that we've had all year. So that is showing pretty significantly underspent. Overall, public health is in a really good financial position. If you look to the right, the revised budget, initially going into 2022, we anticipated spending in the fund balance by $263,000, when in fact through July, if you look at the actual column, revenues less expenditures were actually increasing fund balance by about $2.6 million. So overall, no real concerns at all. Do you have any questions?
Board member questions for Lori about the financials? Anything? Commissioner Gonzalez? Out there? Okay.
Okay, and then also, I did bring gifts. I brought you all a 2022.
Oh,
I'm sorry.
oh, he's there. We have a little bit of a delay, Commissioner, so we'll hesitate and then go ahead, please.
Mr. Chair, he said he was good. Thank you.
It's good.
Oh, okay, thank you.
Thank you.
I did bring you all a copy of our 2022 budget book, and what this is the result of a lot of collaboration, a lot of work between our department and public health to come up with that. What we do is the last couple years is the first time we've done this book. It's a comprehensive book of all of public health's programs and mission and strategic plans and all of that. We do submit this annually for the last couple of years to the Government Finance Accounting Board, or GFOA, Government Finance Officers Association. Sorry about that. And this is, we did receive the Distinguished Budget Presentation Award 2 years in a row for this book. So we appreciate all the collaboration that you all have given us.
Very well done. Thank
you.
Don't sit down yet.
I'm sorry, I actually have a question. I'm trying to frame it in my mind because I still I don't clearly understand. I think a lot of this is probably me not understanding.
Okay.
So it looks like there's less revenue compared to budget.
Yes,
There's also less expenditure compared to budget.
correct.
And the decrease in the expenditure is higher than the decrease in revenue compared to budget. And that sounds like the decrease in expenditure is because we have a staff shortage, so we don't need to spend so much money on staff.
Correct.
Then
Primarily
that takes, correct, then that takes my mind to a conclusion that we are not able to do as much work as we should do. So then that takes my mind to the fact that is there more work than we can do, or the amount of work that we are able to do is appropriate and meet all the required work that needs to be done.
I'll
Did you want to speak to that?
provide some context to that question, and thank you, Dr. Vu, for that question. So community serving 500,000 to almost a million, has, I think it's 365 full-time employees. Our agency has about 220. We are planning for the 2023 budget. So that's where we currently are. And so I think, what we have been doing is, we're an agency that works very efficiently, and we also, achieved public health accreditation, and so our team is small, but it's very productive. Now, I don't think that we're unlike any other agency as it relates to staffing shortages. Sometimes we're going out to recruit certain positions, and we'll have to recruit, maybe 3 different times in 3 different panels, and there's a lot of movement. So I will say that we are having challenges staffing public health workforce. And I also would point out there are different studies as it relates to the impact of COVID that it's had on the public health workforce, and mental health and burnout and all of those aspects. So I mean, we are certainly filling all of those aspects. What we are currently doing and what we always do is prioritize what we're able to do based on data that's available. For example, there's different emerging diseases, and so then how do we staff those and work with different community partners to share the work and collaborate? Because as mentioned, through various previous meetings and today, that we don't work in a silo. We have to work with partners to figure out how we're going to improve community health, whether it's acute situations, emerging diseases, or long-term efforts like we'll be recognizing today, teen suicide prevention and overall suicide prevention, that we get our work done through collaboration. So yes, we are feeling the impacts, and I want to commend my team members, the entire staff, because they are working very hard. They have been working very hard, and they continue to work very hard because they have a heart for public service. And that only lasts for so long in the situation related to how sustainable it is. So we are very aware, and we're trying to do many different things related to an employee engagement survey and feedback from employees. And so there's many different action steps that we're taking. So hopefully that helps to provide an answer to your question.
Yes, thank you, Director Susan. So that takes my mind to the next conclusion is right now the staff that we have working with us currently become Superman. They have to work harder than they can ever work before to try to get as much work done as they can, but that can only last for so long. So the question is, who do we turn to for help in the long run? Do we talk to the county, to the state? What is the long run game?
Yeah, I mean, the good news is when we did go before the Board of County Commissioners back in 2019, they gave us additional funding for critical needs, and so that funding has been a 5-year roadmap, which has been tremendously helpful. And as an example, we were able to staff and build the Office of Data Analytics, which we have not had before. So we are continuing to work, with the county. Also, I would encourage board members, we can talk about state funding, the state per capita, and how we could assure that we are getting that sustainable funding, because currently the funding that we have, the increased funding is for 3 years, and now we're at 2 years. I would like to see that funding ongoing. And then we recently applied for numerous different grants that all get to public health workforce infrastructure, and they're very significant grant fundings. And our budget is primarily grant funded and contracts. That's how we get our work done. And a portion of that we're really grateful for is comes from the county funds, but there's multiple different aspects that we are trying to work on and piece together to increase our public health workforce and sustain our public health workforce. I do want to be clear, I'm not saying that we need 365 full-time employees. I believe that we need to make sure that there's, that everyone doesn't have to be a superwoman or a superman every, while they're at work. That it has to be sustainable, it has to be reasonable, and it has to be based on the data specific to our county, which we're in the process of completing a community indicators report that will lead our community health improvement plan as well as our strategic plan. So those efforts are all ongoing, and I appreciate, Dr. Vu, that you're bringing this up, because the way that we get our work done is through our public health workforce. And if we don't have a healthy public health workforce, then we're not able to do the work, and then that lessens the community health improvement. So I think that is always important to remember.
Thank you so much.
Trustee Ron Stevens.
Yes. My question is, we're getting ready to review another contract. We passed a number of contracts in the last meeting. Are we, now maybe I'm used to, I don't see any specifics in this presentation here, but I'm used to contracts that if you pay me a certain amount of money, I have to provide certain deliverables at a certain time frame. Are we in danger of being in breach of any of these contracts because of our shortage?
No, and I think that, us with the budget office being recognized for numerous different financial awards, which public health offices usually don't seek that rigorous, kind of reviewing of our financials. So we're used to working through a number of different grants. Through the funder, there is an agreement, such as you say, on deliverables, and we have to meet those deliverables. We have to provide monthly reports, and we have to keep in communication with the funder to receive the funding. Some of the funding, we do the work, and then we have to invoice. Some of the funding will come prior, and then we have to demonstrate through documentation that we are fulfilling the responsibilities of what we said we would do. They're all measurable, and the grant that you're talking about, we can certainly provide some more feedback on that, but there's always a scope of work that is tied to deliverables and a very tight budget that goes along with that, and we work to monitor and report and evaluate along the way.
Well, since we're talking about contracts, Dan, do you have anything do you want to come up and address any particular things about this renewal of a contract? Okay.
Thank you, Dr. Chairbush. For the last approximately a year, I have been working closely with the Environmental Health Division Director. Well, we have had some vacancies in our leadership team, but I'm happy to say with today's Board of Health meeting, we have our new Environmental Health Division Director, Roy Kroger, here, along with some members of the Environmental Health team. And I'd invite them to come up and share a little bit about this contract this morning.
Great, thank you. Welcome, Roy, again.
Thank you, Mr. Chairman, board members. The contract we have before you today is a contract with the Colorado Department of Public Health and Environment for $45,000 and for our food safety, our schools, and our child care program. And basically, the state oversees those programs for the entire state, but has delegated that authority to El Paso County. And with that, they want to have a contract to make sure that we're fulfilling the things that they require us to do, and I believe our program actually goes above and beyond what the state is asking us to do. This contract is for $45,000. It is support funding, most of which pays for staff time to work in these programs so that we can do what we need to do when there's less than the fees aren't there to specifically cover some of the things that we do in these programs. And so the state's supporting us to be able to do some of those things beyond our regular inspections and such. So some of the things that we actually get out of this and the community gets out of this is prevention of foodborne illness through our education and working with different establishments across the county. Then we can help prevent foodborne illness. We can prevent children and staff in schools from infectious disease and in child care facilities. And we're also able to educate a lot of the schools on the chemicals that they have stored in there and basically make those a safer environment for both the children and the staff in there. And so with that, I'd like to take any questions that you may have.
Yes, board member questions or comments?
I have a question, Dr.
Please.
Kerbush. And I had written this down. I always do my homework a few days before I come. And we've kind of touched on it with Dr. Vu's question. But this is a lot of work for not a lot of money. And was concerned about, I'm sure that, the fees help, with the salaries and the mileage and all this stuff of the personnel and stuff. But so there has to be some money coming from somewhere to help with this kind of scope of work.
Through you, Mr. Chairman, that is correct. There is a lot of work that goes into this, and my staff can elaborate on that. Those guys do all that work, and they're very busy out there doing inspections and teaching people. And so above and beyond the $45,000 that's in this contract for support, our fees are and general fund support from the county are the ones that actually do the vast majority of the funding for our programs.
Okay. Any other questions or comments from board members? Yes.
I guess I have this small question. Is this contract negotiable? Is it something that we can negotiate?
So I don't have the answer on that. Susan's over here shaking her head no.
No, I mean, many of our grants that we apply for, especially through the state funds, they remain flat, and sometimes they remain flat even over a decade, even though other costs have gone up. And so that is something that we continue to work on as it relates to applying for certain grants and then acknowledging what it actually costs to do the program, and trying to advocate for additional funding through the state. But for the grants, you have to be down to the penny, and they will not take 1 penny. Well, they will not give you 1 penny more, or even 1 penny less with some of the state contracts. And I will say that to make these services available, they are funded also through county dollars as well as state per capita dollars. And there's a lot of nuances as it relates to what can be charged, what cannot be charged. For example, even with restaurant, retail food establishment fees, we send money back to the state. We're not able to, cover some of our costs, and therefore that's how we use money from county dollars and the state funds.
I guess the work has to be done anyway, so 45K is better than none.
That's true.
Yes, and we do evaluate when we take, different grants. I mean, is it going to cost us more to report and meet the, requirements as it relates to some of the reporting requirements and the indirect types of services too that we have to provide to even accept the funding, because there's a lot of monitoring, evaluation, reporting, invoicing. There's a lot that goes along with that.
Councilmember Donaldson?
Yeah, thank you, Mr. President. Mr. Kroger, how many inspectors do we have to do this? What's outlined in this document? Do you know?
So I'm going to let Sammy Joe speak to that.
Good morning, everyone. I'm Sammy Jo Lawson, the Retail Food Program Manager for El Paso County Public Health. In the Retail Food Program, we have just over 18 FTE and specifically 20 environmental health specialists that do this work for the Retail Food Program. I also wanted to mention that something we really focus on in the Retail Food Program is we're mindful that there's a lot that all the various industries have gone through, especially in the past couple of years. So when we are there doing inspections, we're truly doing risk-based inspections. We're focusing on the items that are most likely to cause foodborne illness or some sort of illness that we're trying to prevent. And so in doing so, we spend a lot of time and effort trying to help facilities bridge those gaps, whether it's lack of education because there's a shortage of staff, or we provide a lot of time ourselves when we're in those facilities, providing education and also linking them to different resources that are available, some of which are on demand online as well. And really the name of the game is partnering and offering solutions and working together through any of those problems that we're seeing in an establishment. In addition, we have roughly 150 new build facilities per year. As we know, the county is continuing to grow. So we are still seeing an increase in those licenses as well, even through the challenges of COVID-19. So we have a really awesome, dedicated staff I'm really proud of. I'm happy to take any other questions.
Just to follow up, just so I'm clear, so we have 20 plus 18, 38 full-time employees that are focused in on this.
Yep.
And, you know, the food trucks are kind of something new, at least in Colorado Springs recently. How often are they inspected?
Sure. So we're always looking to inspect them at least once a year. There are challenges, of course, finding them sometimes, but we also inspect special events too. So our staff are out on weekends, on holidays. The next big one is Labor Day liftoff. We do farmers market inspections where we're checking vendors that serve food that require licensure, and also do food trucks there. And anytime we're seeing them out on the street, we also spend time to inspect them as well.
And I'll just close with saying that I think the citizens of El Paso County really see this as a core function of public health, inspecting the safety of our food. So thank you for what you do.
Thank you. Appreciate your time.
Yes, another question, please.
Just another question for you real quick, just so I can get my arms around the scope of what we're dealing with. How many restaurants would you estimate we have in El Paso County, and how many do you visit per year?
Sure. So currently we have just over 2,800 licensed retail food establishments. Keep in mind that does also count grocery stores, convenience stores, school cafeterias, healthcare cafeterias, food trucks, and special event vendors, like I mentioned. Even bars, taverns that serve food, all are included in that as well. You're very welcome.
I wanted to mention something that Sammy Jo said. You know, it's kind of counterintuitive, I guess, going through the COVID pandemic and actually increasing in retail food establishments and not decreasing. So that's what is happening in El Paso County. Now, keep in mind, there has been some closures, but we are continuing to increase, and we are also, what you don't see on this contract, because we do a lot more that's listed than just on this contract, is the on-site wastewater systems, and those continue to increase at a rapid pace with all of the growth. And so, again, with our critical needs funding that the Board of County Commissioners provided to, we were able to hire some additional FTEs to support that effort. And I completely agree, Mr. Donaldson, that it is a core function to prevent foodborne illnesses, and we do it in a way that is focused on high-risk risk facilities, and there's some logic, a lot of logic to what we do, and our folks are trained within the work that they do, and it's very specific to different aspects of the inspections that they are providing. They also coordinate a lot of different collaborative efforts because they work very closely with the industry, and we work on feedback, and we work together. So that is a core function also of bringing the community together and the industry, whether it is the Colorado Association of Local Restaurants, the local chapter of that group, or the installers and engineers from the on-site wastewater system. So this program is very much more than what you're seeing in the contract.
Any other questions while we have our environmental health team up here? Thank you very much. So you have the contract in front of you, and the synopsis, I should say. And if I was to summarize it, it's a lot of work for not very much money. You're right. And these folks do an important job. So having had the chance to review this, I would entertain a motion to approve this as an action item. Second? Okay, all in favor?
Aye.
Aye. Okay. That contract, that renewal is passed.
Thank you.
Thank you.
I do have one additional question about.
Oh, sure.
You mentioned county funding and state per capita funding. Are we obligating the county to match these numbers, or is there any additional funding that comes in on top of this for these kind of projects?
Good question. So the county is obligated to pay for services at a certain level per state law. However, there is no obligation to match the funds for the grants that we receive. And we are always looking for new opportunities and grants for all of our programs, including environmental health, and to support the work that we do.
Thank you.
Just to echo what Susan reiterated, we don't provide the specific match for this particular grant, but we do provide an annual amount of funding to help support the public health programs each year. Thank you.
Okay.
And I guess I would just even clarify further. I mean, the county funds public health services. Our agency is responsible for doing our core public health work in all of the towns and cities. And the cities don't pay into our budget. And so I just wanted to make that point, because in the past we have discussed working with the city of Colorado Springs or trying to seek some type of contribution, and that was before the pandemic. And with the pandemic, we are able to seek and secure additional grant funding, but it's all categorical funding and restricted. So there's always efforts to, manage our budget and seek funding and piece grants together to do the work that we need to be doing.
Are there any licensing fees or inspection fees or those kinds of things that help offset our expenses?
Yes, you have great questions. Provides a lot of clarity. So yes, there is. But when I was talking about the retail food establishment inspections, there is a license that they need to have to operate, but they don't cover their cost. And we have to, per state statute, send funding back to the state for the services that we provide. So retail food establishments pay us, and then we turn right back around and send the money back to the state. And then also some of the licenses that we currently are, having, we don't cover our costs with some of the services. For example, the on-site wastewater systems and some of those efforts. And I think that should be a future discussion, of our board as it relates to an analysis of, what fees cover what costs, and then, what does the board, want to move forward with as it relates to possibly increasing fees or not increasing fees. But those are really good questions. So we do charge licenses fees, but the majority of those fees do not cover their costs.
Good. I'm going to call an audible here very quickly. Colorado Springs Council Member Tom Strand, welcome. Thank you. Now, this next topic is also a core function of public health, and I guess sad and bittersweet, because we have made some significant progress. So we have three guests who have been intimately involved in suicide prevention, and the proclamation is recognizing September as the National Suicide Prevention Awareness Month. Please.
May I have President, Council Member Tom Strand come up? You've been part of the Child Fatality Review Team as well as the suicide prevention effort, so I think that your presence also is relevant to National Suicide Prevention Awareness Month. We have Chris Heber, who is the Chief of Police for Fountain, if you could come up, please. Kirk Woundy, who is the Director of Strategy and Operations at the National Alliance for Mental Illness. We have Cass Walton, Executive Director with the Pikes Peak Suicide Prevention Partnerships and co-chair of our El Paso County Suicide Prevention effort. If you could all come up, because you are a handful of all of the members and collaborative efforts that are involved in suicide prevention, and this has been a long-standing effort in our community. I would also like our team members, Kelsey Leva, as well as Brittany, thank you. And if I'm missing anyone, please come up because I can't see everyone. This has been, this is a huge deal for our community. Back in 2014, if you all remember, Colorado Springs was put on the map. And sometimes we don't want to be talked about. And we were put on the map because of our high teen suicide rate with Palo Alto, California, and Fairfax, Virginia. And that is not a designation that you want to have. So as we work with our community partners, we started reaching out to law enforcement, hospitals, the Suicide Prevention Partnership when Janet Carnes was executive director. There are so many more, and also with our coroner's office, Dr. Kelly, and his team, and our county leaders also. Our county leaders at that time, it was Henry Yankowski was the administrator, and we were crying out for help because it was just a really, really tough time. And this was something that we have been advocating for sustained funding for and the effort, because we cannot let up the momentum. That is something that is critically important to our community. And we talk about protective factors and the prevention work that goes along with that, and it is so important. And it's even more important when later on when we give an update about substance use. The work that we do in connecting kids and mobilizing youth work groups and collaboratives is so critical. But this is the team of many of the leaders that work day in and day out, and I can't say enough to you all is how grateful we are for you, because I know it's heavy work. It is something that it touches you so deeply, and I think that where the hope is that we're making a difference, and you all are making a difference. And I have data, and it's much more than the numbers, because it impacts the community, impacts parents and loved ones and friends, and you just don't snap back from a youth suicide. So with that, we extend our appreciation from the board, and thank you so much for being here. I love working with you all, and I just greatly appreciate the work that you do, and we're here to recognize that good work and also the many others that are not here, because there are a lot. There are so many multi-sector partnerships and schools and law enforcement, coroner's office and hospitals and additional elected officials, and it's just this is something I think that everybody supports, is the health and well-being of kids. And with that, I'll turn it over to you, Dr. Turbush, if we want to read the proclamation, or if we wanted to have comments before.
Well, let's do comments, because I'm sure there are a lot of board members who would care to weigh in on this important subject. Commissioner Bremer, please.
You're putting me on the spot first today. Yes, this is something that we often comment on as the Board of County Commissioners as well. And it's a huge piece of the work being done in this community as a whole. I think our charge here on the Board of Health is to ensure the safety and well-being of our community, and that includes so many facets, and more and more frequently, behavioral and mental health are a piece of that. And I'm glad to see that we have dedicated volunteers and dedicated professionals who are willing to dig down and come to some solutions on that. We had a presentation last month on child fatality review team, and I think the ability to collect the data and know what's actually happening in our community, and particularly in our youth, is the whole point of that is to drive to solutions, see where we can help prevent, see where we can provide more support and tools and resources and conversation starters that will over time make an impact. So thank you for being willing to dig in, take a look, and I know it's really devastating hard work, but we're very, very grateful And please know too that we had great success with implementing some prevention strategies right up front. But that was remarkable in how quickly it moved the needle. And I don't think that we can expect to let up on our efforts and still see that type of improvement. So carry on, continue on, and let us know if you need anything else.
Good. Not to be forgotten, Commissioner Gonzalez?
We can't hear you.
We can go around the table. Any other comments, questions? Yes.
I'll just
Fire
make
Chief.
some brief statements. Having been a first responder for the majority of my life, I've seen firsthand the impact and the grief of suicides on families and on friends and entire communities. And I just want to say thank you, because prevention, if you prevent one of those tragedies, you've done a service to this community. I'm very grateful.
Absolutely.
Again, I just want to say thank you, because I know this is difficult work and emotionally draining and probably very prone to burnout, but I appreciate your sticking with it and helping our community in these regards.
Thank you.
And
Go
I'd
ahead.
like to ask, anyone standing up there, if you'd like to say a few words.
Yes.
We do have data, and I'll share it. But again, I mean, it's much more than just numbers. And so in 2015 is when our effort had mobilized. We had 14 youth suicides, ages 0 to 17. In 2016, 15, 2017, 13, 2018, 7, 2019, 9, and then 2020, 16, and then 2021, 4. And I don't have updated numbers for 2022, but you can see that it's still important work and needs to continue to build. And I completely agree with Mr. Colas that preventing, one, I mean, is success. And so I would just ask anyone that's standing up there, and I know that, one person up there, I know very well, Chief Heber, he's never at a shortage for words. So maybe.
You're hard to miss. Hard to miss.
Yeah. But you've been a longstanding partner as long as Cass with the suicide prevention, if you'd like to say anything.
I would like to say just thank you to all of you. This has been a time that we've seen more collaboration in El Paso County than ever before. And I think that's very reflected in that in suicide deaths. That was probably our biggest win, suicide prevention, in a long time. And so to see it drop to that number 4, while still knowing that even 1 is too many. And I think what I want us to keep in mind, because we are a community that really shows up in crisis. That is something that we are very good at. And we really need the help of everyone in this room to ensure that the efforts continue and that we continue to keep our eye on this. For me, every day I feel like I'm running from something that's right behind me. Because while I know we saw those reductions in youth deaths, we're still not really moving the needle on our working age white male. And so there are a number of people in this community that while we can say in a conversation, this is an issue that I'm concerned about, we still need to mobilize our small business community. We need folks like all of you to be engaging with the Suicide Prevention Collaborative because, you know, I'm not a person that everyone listens to, but I think those of you who are in these leadership roles across our community, you're so well respected. And so people are very much willing to listen to your voices. And something that we have learned is effective in this kind of work is finding the voices that people are willing to listen to. And all of you sitting here today are some of those people. And so I'm grateful for all of the support, and I'm proud of the collaboration. And I just really beseech everyone to continue to partner with us and intentionally take action to continue to save lives.
Thank you, Cass.
It's always difficult to follow Cass. She does a great job. A couple of things. I want to thank Ted Colas for his comments on Deputy Perry. And I just want to say this for everybody. You know, it matters to that sheriff's deputy back there and that 3,000 men and women that serve this community through dispatchers, firefighters, police officers, sheriff's deputy, that when we lose a fallen hero, our community shows up. Thank you. Makes a difference. Number two, Dr. Vu, when you run out of Supermen and superheroes, we call Ghostbusters in the city of Fountain. I just, you know, you were having that conversation. Ted Colas doesn't know the number for the Ghostbusters. He's a firefighter. I do. We have the secret code, and we call him down there. Talking about heroes, I have the honor to co-chair the county group with Cassandra, and I would just, there are so many incredibly passionate, talented people that are deep in the octagon, standing firm, fighting this thing. Dealing with people that are considering suicide from high-risk categories, dealing with the aftermath of families and friends that exponentially increases suicide after a completed suicide has been done. There are so many people, talented people in this county that are engaged deep in the octagon. I know we will make a difference, and I do agree, and I spoke about this 3 or 4 years ago when we came together as a county at UCCS. We measure the needle by one. And you're never going to know sometimes who you save and who you don't save or where you made an impact. But you know, that's the encouraging work, to stay planted, to keep moving forward. It is hard work. It's noble work. I'm really proud just to serve with all these people and everyone that's touching that. They're amazing. They really are supermen and superwomen. We all should be so proud of them. Thank you for your support. I would just ask we continue to support, continue to tell the story, continue to help each other and encourage each other. We're very blessed to be in El Paso County, and thank you very much.
You didn't really lower the bar there with the whole thing. But I just, I'm with NAMI, just want to mention that as much as the collaboration that Cass has talked about has been incredibly important to this community, and as much as the topic of suicide can be just very, very intimidating, the fact is that we all, on an individual level, have actually a lot of power in trying to fight back against suicide. And so I would just encourage everyone to keep in mind, to let other people know that there are trainings like mental health first aid and QPR, many of which are actually run through Cass's group at Pikes Peak Suicide Prevention, that can help people feel more comfortable and better equipped to help others when they're in need. And I would also just like to thank all of you for taking the time to recognize Suicide Prevention Awareness Month. And on behalf of all of us at NAMI, and if I can speak for the other partners who are also part of this effort, it just feels really good to have support from the highest levels, and to know that, as Cass said, you're all incredibly trusted and great ambassadors for this cause. So thanks very much.
Thank you, Kirk.
I'm Tom Strand. I'm your neighbor on City Council, and in 2015, I was first elected to City Council after serving 6 years on the District 11 School Board. So I hit this thing with our youth prevention, and one of the people I want to give credit to who isn't here today is Coroner Leon Kelly. When I'd come to the meetings for the youth prevention of suicide, when we hit the apex of this, Leon was, I think, the number 2 or number 3 at the coroner's office now. He's obviously our coroner. And he would talk about these cases individually, primarily males, primarily hangings, primarily gun shots, in some cases wrist cuttings, and it was heartbreaking. And we were nationally getting the attention throughout our country at that time. To listen to the numbers that Susan just went through, and she was in a different position then, Dr. Turbush was in a different position then, Chief Colas was chief of police, and it's amazing in 7 years how yeah. It's amazing, how in that short period of time, how everything has, changed. And in youth, loss of youth has gotten so much better because everybody's pulled together. But Coroner Kelly has really done a terrific job, and I want to give him a full recognition for that. As I'd go home from these meetings and I would be down for days as a result of it. And so I think we have a lot, as we're proclaiming this month as National Suicide Prevention Awareness. We're making awareness. We need to look at our history and how far we've come. And so, Susan, thank you very much to you, and we appreciate your efforts.
And thank you, Mr. Strand. I want to echo what Cass had emphasized, and I think Chief Heber and Kirk as well. We need leadership, sustained leadership as it relates to involvement, because the elected officials, your voice, you have so many more connections and people listen to you. And I remember Tom Strand reaching out to me and said, "Hey, Susan, I really want to get involved." I didn't, I was seeking people to get involved because at that time it was Dr. Kelly and I leading the child fatality review team. But Mr. Strand came to me and said, "Can I get involved?" And I think that's leadership, being there for whatever it might be, and being a presence to further the work. Because when we talk about primary prevention, many people don't even know what that is. We know what it is because we work on public health, but if we are truly going to make a sustained long-term difference, we have to do a multitude of different efforts, and primary prevention is going to be sustained, and that's how when we work together. So I think that's we've had a lot of leadership involvement, and our Board of Health has been heavily involved, as well as our county commission and our city council, Colorado Springs City Council, and our city of Fountain council. So in the schools. So they have been involved. I want to see more involvement, sustained involvement, because we are also facing some other issues with youth, and it all is going to need our attention, and it's not going away. It's not going away next year. It's not going away in 2 years. We are going to have to keep up these efforts. So thank you all. And I, Kelsey Leva to the left, she's helped lead the Child Fatality Review Team, and Britt, she's also our, I get titles wrong because we change titles so oftenly, but youth suicide prevention planner focused on health and wellness. So we appreciate the work that you all do.
Thank you. Okay, well, I'll go ahead and read the proclamation, and then I'll entertain a motion to approve. Second, and we'll take a vote. And yes, Michelle, you'll be able to organize a photo op for us? Okay, here we go. Proclamation of the El Paso County Board of Health recognizing National Suicide Prevention Awareness Month 2022. Whereas there were 1,370 deaths by suicide in Colorado during 2021, and whereas 186 El Paso County residents died by suicide, and thousands of their friends and family were forever changed by these losses last year. And whereas in El Paso County in 2021, suicide was the 9th leading cause of death for people of all ages, and men accounted for a disproportionate 78% of those deaths. And whereas in 2021, the U.S. Surgeon General issued an advisory on youth mental health, and Children's Hospital Colorado issued a state of emergency in youth mental health. And whereas although El Paso County saw a decrease in youth suicides in 2021, 1 year of data is not enough to establish a trend. Therefore, it remains vitally important to continue suicide prevention efforts with partners throughout the county. And whereas youth mental health and suicide prevention has long been a top priority of El Paso County Public Health, who convenes Youth Suicide Prevention Work Group, a collaborative of community partners taking collective action in support of youth mental health and suicide prevention. And whereas the local community and the Youth Suicide Prevention Work Group were also deeply invested in layered suicide prevention efforts, including the Suicide Prevention Collaborative of El Paso County, an alliance of organizations and community leaders with a collective goal to reduce suicide deaths in El Paso County by 20% by the year 2024 among all age groups. And whereas September is National Suicide Prevention Awareness Month, a time when mental health advocates, prevention organizations, survivors, allies, and community members unite to promote suicide prevention awareness. And whereas El Paso County Public Health recognizes that together we are changing the conversation about suicide by replacing myths and stigma with information and action steps everyone can take. El Paso County Public Health urges all El Paso County residents to take action and prevent suicide in our communities by learning about the risk factors and warning signs, asking about suicide directly, being there for those who are suffering, keeping them safe, helping them connect to resources, and follow up after a crisis. Now, therefore, be it resolved that by the El Paso County Board of Health, the month of September 2022 is proclaimed as El Paso County Suicide Prevention Awareness Month in El Paso County, Colorado. El Paso County Board of Health recognizes that no single suicide prevention effort will be sufficient. Through the combined action of El Paso County residents and community suicide prevention initiatives, we can all work together to increase awareness, take action, and prevent suicide. So I'll entertain a motion to approve.
So moved.
Second.
All in favor?
Aye.
So this proclamation has been moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on August 24th, 2022 in Colorado Springs, Colorado. And are you folks willing to come up again for a photo op one more time? Okay, thank you.
Thank you.
Good to see
Bring this back on. Where's I don't see.
She's here.
There she is.
She's here with her husband.
Oh, good. Okay, this next item of new business is sad but congratulatory. Lisa Powell, come on down. I've known Lisa for how many years now? 20?
20.
Since I was at Northcom and
Yeah.
you were here doing work for the county and the city. And we did emergency preparedness work together. And I've always enjoyed you. I've enjoyed working with you and consulting with you. And I always appreciate your insights and expertise. And now at the end of how many years of service?
32.
32. Okay. Well, we have a resolution to recognize the retirement of Lisa Powell.
While you're looking for that, I'm going to say a few words if that's okay. So I started in 1999, and Lisa was already here at the health department, and we were located at 301 North Union Boulevard, right across from Prospect Lake. And I've tremendously enjoyed working with Lisa. Back then, Lisa was the program manager or director, and I'll get titles wrong, but we had a McMaster's clinic, which was all about substance use, misuse counseling, as well as a methadone clinic. And I was hired as an environmental health inspector, but when I was promoted is when there was many budget cuts, and one of my jobs was to communicate to the community that the methadone clinic was going to be no longer. And as you can imagine, I was relatively new, and Lisa is a force to be reckoned with, you know, in the agency. And so that's kind of how we met and we bonded. And then 9/11 happened, and we received funding for public health workforce to be trained as first responders. And so we were really brought into the fold and required to attend and get certified in national incident management systems and so many different trainings depending on what your role was. And Lisa was the leader that actually helped spearhead much of that. And there's going to be much more information in the resolution, but I've always enjoyed Lisa's leadership and getting stuff done, pushing through when maybe we needed to push through, and you know, have a seat at the table for public health because it was relatively new as well, and learning the lingo, the terminology, and you know, there were so many you know, situations that we've been through. And there's a lot more information in the resolution, and I'll chime in later. But one thing to look forward here in public health also is when you retire, you look at least 10 years younger. I mean, at least. I mean, you just look fabulous. So, yeah, so that's something for some of us to look forward to.
That's good. Other comments? Tammy, you know Lisa.
Sure. You know, I noticed that your official retirement date was the 1st of July, and yet on the 4th of July, I saw you in your El Paso County Emergency Management shirt working hard at the 4th of July parade. And that is symbolic of a life of dedication to a cause, and you can be very proud of your life's work here. And that's a dedicated public servant right there who, after her official retirement date, is still doing her job, essentially. And I was surprised and delighted to see you join with your teammates there on that, and it was just fun. That will always stand out in my mind as really just an example of how hardworking and long dedicated you are. Thank you.
Other board member comments? Yes.
Yeah, Lisa, I want to say thank you also for your service. Yesterday at City Council, we recognized a city employee who'd been there for between 20 and 30 years. And I've said this to several folks, it's people like you that stay with an organization and you develop that institutional knowledge, and when new people come on board, and you've seen things tried in the past, what's been successful, what happens. And that's really, you can't put a price on it. And that's what makes organizations like this public health or other agencies here in our city and county really good, is when people stay and really, you know, give part of your life to that organization and to our county. So thank you very much.
Thank you. Anyone else? I'll go ahead and read the resolution. Resolution of the El Paso County Board of Health, whereas Lisa Powell has been an employee of El Paso County Public Health from the 8th day of June 1990 to the 1st of July 2022, whereas the El Paso County Board of Health desires to acknowledge the retirement of Lisa Powell from service to public health, and whereas Lisa Powell's service and dedication have contributed to the successful service of public health, and whereas Lisa Powell served as a leader during numerous all-hazard emergency responses, to include the 2009 El Paso County response to H1N1, the 2012 Waldo Canyon fire, the 2013 Black Forest fire, the 2015 Colorado Springs Planned Parenthood active shooter event, the 2019 hepatitis A outbreak, and most recently, the COVID-19 pandemic. And whereas Lisa Powell was instrumental in leading efforts for El Paso County Public Health to earn national accreditation via Project Public Health Ready in 2008, overseeing the successful renewal of accreditation in 2013, 2018, and most recently leading efforts to apply for reaccreditation in 2023 amid the COVID-19 response. And whereas Lisa Powell is a recognized subject matter expert in emergency preparedness and response, whose impact extends beyond El Paso County, serving as the chairperson for the South Central Healthcare Coalition, participating in National Association of City and County Health Officials work groups related to incident command, as well as the Preparedness and Policy Advisory Group, and serving as a national plan reviewer for Project Public Health Ready. Now, therefore, be it resolved by the El Paso County Board of Health as follows. Number one, that the El Paso County Board of Health expresses its appreciation and that of the residents of El Paso County to Lisa Powell for her dedicated service to public health, and that the El Paso County Board of Health joins in this grateful acknowledgement of Lisa Powell's service as indicated by the signature of the Board of Health President below, and that this resolution be first read in an open public meeting of the El Paso County Board of Health, and a signed copy delivered to Lisa Powell, and then also entered into the meeting minutes of the El Paso County Board of Health as a permanent record of the board's grateful acknowledgement of her service to the enhancement of public health and the environment in El Paso County, done this 24th day of August, 2022 at Colorado Springs, Colorado. And I think we have another photo op. Okay, Lisa, any other comments? Anything you want to say?
So thank you all so much for those kind words. My work at Public Health has been more than just a job. I love the work that I do, the work that I've done. It's not the last that you'll see of me, because I will still seek moments when I can be of service to the county. Susan reminded me of a couple of things in regards to my career. When I was in opiate replacement therapy as the program manager, and we decided to close down that program, I did say that I thought that it was incorrect to believe that we did not have an opiate problem in Colorado Springs and El Paso County, and we can see now that, you know, we've come back full circle to that being an issue that we're tackling currently. So I look forward to seeing the work that has been ongoing and will continue in that arena, as it's incredibly important. We learned a ton during all of this incident command component, and I was reflecting back on pictures that I saw of all of the exercises that we've done over the last few years, and I saw picture after picture after picture of the leadership of our health department practicing incident command, practicing what it would be like if we had to do this kind of work. And that is what really helped get us through the pandemic. We saw, you know, people just jump right into those positions and do that work fairly seamlessly, even though it was hard work, but really because of the practices that we were able to do with those exercises. So supporting emergency preparedness And that training and exercise component into the future is going to be paramount to our continued success as a community. Thank you.
Well done. Lisa, your husband's here. Can we recognize him as well, please? Team effort.
My husband George, who's been
George.
standing by throughout the, especially during the pandemic when I was working from home, and he would push food towards me while I was on meetings. And
Well, thank you, George. And a fellow sailor?
Thank you.
Good enough.
Mr. Chair,
Oh, I'm sorry. Go ahead.
I would like to move approval of this resolution.
Absolutely. A second?
Second.
All in favor?
Aye.
Great.
also, my team is here that I've worked with for many, many years, so I'd love for them to join us as well.
There you go.
Okay. Are we scrunched enough? Just about there? Okay. Okay, I think it's Director Whelan's report.
Okay. So there are a few things that I want to highlight, and then we'll have a presentation also, monkeypox update as well. And we do have Dr. Bernadette Albanese online now. But before we get to that presentation, I want to provide a video that we created in recognition to our El Paso County and Colorado Springs Vaccine Consortium for the national recognition that was received by the National Association of City County Health Officials, as well as the National Association of County Officials. And they both had pretty recently, I think it was last month, actually still this month, some conferences. And so El Paso County Public Health was recognized, and so that does highlight the county. What I wanted to say was that this is a perfect example of Public Health 3.0, again, where we don't have to do all of the work. We pull together partnerships from hospitals and providers and first responders and schools and various entities to mobilize. Public Health provides the data and the analytics and the expertise, and then we work together to try to solve problems. If you remember in the beginning, we ran into a fire hose of issues and challenges. There was a limited vaccine. At that time, the Vaccine Consortium, all we could do is take the vaccine that was provided to us, and then we had to have members of the public actually have a computer to be able to make an appointment. And I think that we can agree that that was highly inefficient and created a lot of barriers. And so we were thrilled when we had increased access and we could just do walk up and manage the clinics differently. So that vaccine consortium worked through numerous challenges related to, what were the limits, how are we going to come up with solutions to serve the public? And we navigated, all through the way. The Vaccine Consortium was first a policy committee that met 7 days a week. And then we transitioned into a vaccine consortium when we had the vaccine. And I did want to say, I think before we had certain board members where when Fire Chief Colas was still in his role with the city, he had served on the policy committee as well as the vaccine consortium, as well as Dr. Vu had served on the vaccine consortium was very helpful. We also had members of the city of Colorado Springs and other municipalities, as well as Mayor Suthers. I don't think he ever missed a meeting. And I really appreciated his support all throughout the pandemic. And you'll see him in this video as well. And we also had Commissioners Lojinos Gonzalez, and then Commissioner Stan Vanderwerf, as well as Commissioner Cami Brimmer and their board members as well. So with that, let's play the video, and just I think it's important to recognize all of the foundational staff from public health, from immunizations to communicable disease to data analytics. My staff heavily helped out with the core responsibilities of the vaccine consortium to achieve all of the great work that we accomplished.
We couldn't function through healthcare providers solely, so what we did was we worked with pharmacies throughout the county, we worked with schools, with mobile events, we worked with YMCAs, we really worked with anyone that was willing to have a vaccine access point to offer vaccines to the public.
Anytime you can get so many parties to the table, and that's what we were doing with the vaccine consortium, you're going to get a lot of buy-in, and you're going to hear from a lot of disparate voices. Products going to be better. I think that's what you could say about the vaccine consortium.
Another innovative way that I think that was really important is that we worked with one of our healthcare providers, Matthews Food, as well as the Colorado Springs Fire Department. And for homebound people, we would go home to home and offer them a vaccine. And sometimes those are the people that are most vulnerable, at high risk for COVID. There was a multi-pronged way in which we reached out to the community to reduce barriers.
Innovation is more than being on the cutting edge of technology. Innovation is about approaching a problem and thinking differently all the way around it.
And when you have the right people at the table, concerned about their community, you're going to end up with innovation and people ready to do anything it takes to take care of their community.
I think it's highly important to note that we had many elected officials who supported our efforts and also participated on our vaccine consortium because they represent different districts, and their leadership related to educating the public and also helping us promote the vaccine availability for those that wanted the vaccine was really important.
It makes my job as a policy leader much easier and much more rewarding, quite frankly, to see that amidst all the chaos of something like a pandemic, that we have a group of individuals willing to come together and say, hey, we have a solution. We're all struggling right now, but here's a solution, and how can we work together for the health and safety of our community?
Public health functions on collaborations. We cannot get our work done without collaborations, working with traditional and non-traditional partnerships, being innovative and effective through our service delivery models.
Thank you, Erin, for playing that. I also wanted to mention that oftentimes communication team members don't get the recognition I think that they deserve. El Paso County's video and communication office developed that video, so I want to say thank you that they were able to do that, as well as our team had worked on that. There's a lot that goes into those few minutes. But the awards that we were recognized for was the Bronze Innovation Practice Award with the National Association of City and County Health Officials, and then the 2022 Achievement Award from the National Association of County Health Officials. And this is due to the hard work of my team members throughout the agency, as well as our partners. So I think that that's something to be proud of. Let's go to introduce Dr. Bernadette Albanese. She is with us, and she, as I mentioned earlier, one of our co-medical directors. And previously, in the early, Dr. Albanese, I think it was early 2000s, maybe from 2004, maybe to 2008, you were medical director here. And so many of us are familiar with you, and she's going to give an update on monkeypox. But if you could first introduce yourself, please. Hold on, we're trying to fix the audio.
Dr. Albanese, where?
Stand by, Dr. Albanese. Okay, go ahead.
Here she is.
Good morning, we can hear you.
Okay, perfect, thank you. Okay, good morning, so thank you for that introduction, and nice to be with all of you. A repeat greeting for this meeting. It's a pleasure to be back at El Paso County Public Health as the co-medical director, and I appreciate working with my colleague, Dr. Palmer, as we team up to do some great work in the county. So it's a real pleasure to see all of you. So I've been asked today to give a monkeypox update. So let's run slides. Next slide, please. So just to give you the up-to-date data in Colorado, this number is actually up to 197 cases, laboratory confirmed, or test positive cases identified in Colorado. 6 persons have been hospitalized, and there's been no deaths among our cases. There's actually been no deaths reported nationally as well. In El Paso County, we have received reports of 11 cases on persons who live within the county. Next slide, please. This is information that the State Health Department CDC is now posting on their website. They just give a little bit more background about who's impacted by this outbreak. So on the left, you will see cases reported by county residents of the case, and this has, impacted the population corridors of Colorado, and so Denver, Adams, Arapahoe, and Jefferson, El Paso, Golden, and Larimer counties seeing the most cases up to this point. The other tables identify race, ethnicity, and gender, sexual orientation, and age group. This outbreak impacting persons, white persons as well as persons of color. When you look at that data nationally, there is actually a disproportionate representation of cases among our BIPOC population, whether that be Black, Hispanic in particular. This outbreak also impacting mainly young adults, and 25 to 44 years of age. Most of the cases identify as a male cisgender, and although we are seeing cases come up in other reported genders. And in terms of sexual orientation, you can see that about 68% of the cases around the state are persons identifying as lesbian and gay, but also among persons identifying bisexual, heterosexual, or another sexual orientation. Next slide, please. So as the data indicated on the previous table, this is also consistent than what's being notated nationally. The highest risk remains among adult men living in the metropolitan corridor who report sexual contact with other men. And it's not exclusively all cases, but it is the majority of cases. In Colorado, we have cases among persons experiencing homelessness or in other institutional settings like being incarcerated or detained, but with provision of the institution of infection control measures, there has not been any transmission in those institutional settings, which is good news. Next slide, please. So let's just talk about a reminder about how monkeypox is spread from person to person. So when someone experiences monkeypox infection, almost everybody essentially develops a rash. The rash comes in different appearances. It comes in waves. It can start and spread in different parts of the body. But the rash lesions have a lot of virus within the lesions. When you are testing someone to confirm whether they have monkeypox infection, the lesions are swabbed, and that swab is sent to the lab, and that's where the testing is performed to identify monkeypox virus. So most transmission is occurring when you have close skin-to-skin contact with someone infected with monkeypox who has rash. Sometimes those rash will become sores. They can be skin bumps. They can be scabs. So any of that form of the rash is infectious. And so any close skin-to-skin contact with that rash can lead to infection of the other person. And we're notating that this is particularly common during sexual activity. The virus can be transmission when symptoms start all the way through the rash, completely healing. And so it needs to go through a phase of scabbing. The scab falls off. The skin underneath, just like any other type of scab, will eventually become healthy skin. And it's only at that point that the risk of spread is eliminated. But that can last several weeks actually. This rash illness lasts a long time. It is possible that touching objects or fabrics such as clothing or bedding or towels or other surfaces that have been used by someone with monkeypox, and the virus may have temporarily, especially if they're scabbed, come onto that inanimate surface, and then if that surface or the fabric has not been cleaned, that it's possible that if another person comes in contact with them, that they may also acquire an infection. But really, most transmission is occurring from close contact, skin-to-skin contact with the rash. Data demonstrated that we are seeing increased risk among gay, bisexual, or other men who have sex with men, and that monkeypox can spread during intimate or sexual contact, which can include touching or hugging or kissing, or even prolonged face-to-face contact, particularly if someone may have the rash lesion in their mouth. Next slide. So testing is now available both at the CDPHE lab, which is the public health lab around the state, was the first lab to offer testing using a test method developed by the CDC. But now several large commercial commercial labs around the country, they're listed on your slide, offer monkeypox testing. And so this was a big push out by the CDC and Health and Human Services to make testing much more available and sort of much more sort of routine by making it available through commercial labs, such that any provider, including primary care providers, can swab a rash lesion and send it to a commercial lab and get a test result. So it's not just a dependency solely on public health laboratories in Colorado or around the country. CDPOG lab testing is trying to be reserved for uninsured clients because the commercial labs are going to charge for the tests just like they do any other laboratory test that we might have done when you go to the doctor. Next slide. All right, so in Paso County Public Health, so at our sexual health clinic, there is some limited capacity to perform testing as part of a sexual health evaluation. So not only looking for whether rash lesion that someone may be experiencing in the genitalia, for example, might be monkeypox, but also other sexually transmitted infections like gonorrhea, chlamydia, or syphilis. Next slide, please. So thankfully, there is a vaccine that we are using to try to curb this outbreak. The name of the vaccine is called Jynneos. And this is a vaccine that we developed mainly for smallpox, but based on the similarity in the type of virus that smallpox is and monkeypox is, they're in a family called orthopox viruses. And in the same family of that virus. That an immune reaction to a smallpox vaccine, Jynneos vaccine, may also provide protection against monkeypox infection. So this is based on data out of work with laboratory animals, and then immunity studies. So meaning you vaccinate someone with the Jynneos vaccine, you take a sample of their blood, you measure their antibodies and blood, and in laboratory settings, test that antibody against monkeypox virus. And so based on this laboratory data, it is expected that the Jynneos vaccine will have an impact and will have a protective effect against monkeypox infection in this outbreak. But I will tell you that data is now trying to be verified by real-time studies conducted by CDC and the National Institute of Health and other academic centers to ensure that we are getting the expected response. So we are using this vaccine as a way to try to work our way out of this outbreak. And then hopefully as we get some more data, again, real time, that we'll see encouraging data to support that. So we use the Jynneos vaccine right now to try to protect someone who might have been recently exposed to monkeypox. If we receive the vaccine is what they call post-exposure, so after exposure prophylaxis, either stop the infection altogether, or if the infection occurs to severity of symptoms. So this is a vaccine that should be get it after exposure, the better. As indicated on the slide, we try to get it within the first few days of exposure, but it's certainly within the first couple of weeks of exposure to at least try to ease the symptoms. And so this vaccine is purchased by the federal government. It's been passed on to the states in Colorado by CDC, and then either they're administering it in their own clinic or it's being shared with a lot of the public health agencies, including the Paso County Public Health, and administered to clients. Next slide, please. So this is currently the vaccine eligibility to receive it. This vaccine still remains pretty significantly limited supply. This is really an unexpected outbreak with a really rare disease. And so trying to ramp up production for this very rare vaccine is taking some time, but every couple of weeks we're able to release more doses, another 1.8 million doses being released this week, and we will have that come down our allocation in Colorado. So this is the criteria that we are using. So anyone 18 and older who's had close physical contact with someone with monkeypox rash within the last 14 days, gay, bisexual, or other sex, men who have sex with men, or transgender or non-binary or gender diverse people 18 or older who have multiple sex partners, anonymous sex partners, or are participating in sex venues where you may not know your partner and you may not have the opportunity to inquire with that partner as to whether they have a rash that might be monkeypox. And so we're going to be using this criteria for now, CCHU, continually revisiting this as we speak. And hopefully if that supply increases, we'll be able to open up other fields. Next slide, please. So prevention is multifold. One is if you think you've been exposed, try to get vaccine, right? But also if you are infected with monkeypox, please stay away from others until all those lesions heal and leave stuff, and avoid sharing objects or fabric with other persons. Ask your sexual partners if they have a recent rash suggestive of monkeypox, and then make decisions accordingly about the sexual behavior. And then for some individuals, it may need to be a time to take a temporary break from activities that increase your chance for exposure, such as avoiding multiple anonymous sex partners or sexual activity in spaces where that may occur. Condoms may have some protection. I think that the data is extraordinarily limited on this monkeypox infection. And some persons with monkeypox, upwards now 20 or so percent of persons with monkeypox being infected in Colorado will also have other sexually transmitted diseases. So I'm going to pause there. Thank you, everyone. Thank you, Susan. And I'll take any questions.
Any questions? Yes, Doris, please.
Dr. Albanese, thank you for the thorough presentation. Appreciate it very much. I have a question, though. Maybe you can just shed some light, or maybe Susan can. You state that El Paso County Public Health has limited capacity to conduct testing for those without a primary care physician. Can you expound on that a little bit? Why is that? Or are we doing any testing, or is it all being referred out?
With testing available at commercial laboratories, theoretically any provider has the ability to test if they be willing to properly send it off the lab. There are some detection control requirements for persons collecting specimens, like wearing a mask and wearing gloves and a gown, so that you don't inadvertently have any rash scabs or something like that come onto your skin. Sexual health clinics, infectious disease practitioners in the county also are offering testing, and again, individuals coming in with a rash and genitalia lesions, for example, evaluated for other sexually transmitted infections in addition to monkeypox, depending on the appearance of the rash. And my understanding, and maybe Deanne can weigh in a little bit more on this, in our clinic, our staff has been trained to evaluate rash and inspect monkeypox. They're trained to sort of how to collect specimens. And I think my understanding is we've had about 14, I think, persons tested for monkeypox. I think data that body shared, detecting 2 persons positive by testing. So we do have that agent within the capacity of our staffing in terms of being able to get patients that they want to be evaluated. So maybe Deanne, you have a little more information in that regard.
Certainly. Thank you, Dr. Albanese. I would just add that we are providing the testing within our clinical services, and we have trained providers available to do that testing. Regarding capacity, as Dr. Albanese mentioned, we are a relatively small clinic, so in terms of volume to serve the community, we are one piece of the overall provider network providing tests for monkeypox. So the limited capacity is related to our relatively small size and limited number of appointments to serve the public, and being part of the larger community framework for monkeypox testing.
Thank you.
Good. Dr. Bill?
Dr. Albanese, I apologize. Go ahead, please.
President, CCHE has shared a lot of training with providers. I mean, this is a new disease, right? This is a new disease around the world, other than origins in Central and Western Africa. And so, learning curve for providers to recognize the rash might be monkeypox and be with infectious disease. There's lots of education materials and lots of training offered to help providers get comfortable that someone can hopefully go to their primary provider or go to their urgent care center and access to services.
Thank you. Can I have 3 questions, please? The first question is the vaccine, Janelle, can you please clarify, is it a live vaccine, and can people who are immunosuppressed get them?
Great question. Thank you for that. So Jynneos is a live attenuated vaccine, meaning that there's live virus in there, but the virus is not capable of replicating and causing infection in the person who receives it. Therefore, an immunocompromised person can receive the vaccine. The other smallpox vaccine, anyone a little bit gray hair like myself may remember, is called ACAM 2000. And that's the vaccine that some older person may remember getting on the surface of their deltoid, the deltoid muscle that left a little scar. That ACAM 2000 is also a smallpox vaccine. However, that is a live replicating virus. In fact, it's local infection on smallpox infection on the skin with a modified virus. The modified virus that only causes a little bit of infection on the skin, and then that is used. Now doesn't. There are potential risks. Person having live virus replicating on the skin and then inadvertently inoculating other parts of their body or inoculating their eye. There's been a huge preference to use vaccine as part of this response from a safety profile. So that vaccine, there's no issue about live virus replicating that can infect anyone else just from being vaccinated. It just causes the immune response, causes your body to create antibodies so you're protected.
Thank you. Second question, Dr. Albanese, are the medications designed directly to treat monkeypox? And is there a medication that was designed for smallpox that may or may not help treating monkeypox?
Thank you. That's another great question. So there is a medication. The chemical name is called tecovirimat. The name that is called Tepox, or the name, the brand name that is used, and it is a medication that is approved by the FDA for monkeypox infection. Also, being extrapolated from laboratory use and laboratory testing against smallpox. So in the United States, in order to be able to use monkeypox on a patient with monkeypox, it's under what's called emergency investigation drug. So a drug that the pharmaceutical company is familiar with viruses, but again, in the monkeypox world, it's a new application. And so there is some paperwork that the provider needs to fill out when wanting to treat someone with monkeypox who, meet criteria treated, particularly their course or having rash in sensitive areas, particularly around the eye, to try to avoid eye infection. They have rash in the face. And there is just the paperwork and CDC program to help the provider get through that paperwork quickly. But it requires some reporting and follow-up back to FDA, in particular any adverse events that were unexpected and whether the patient is. So it's a little clunky. It's not just something that you can go to any pharmacy and pick up. It has to be something you process with the FDA. All investigation. Give me a second, or I'll get back to you in email in terms of how many courses have been used around the country, but many patients are receiving Fox qualify and need the medication with at least anecdotal reports of these. I think more data will be forthcoming.
Thank you. Last question. There were 6 hospitalizations in Colorado. Would you have the reasons for those hospitalizations, please? Would you please, would you have the reasons for the 6 hospitalizations in Colorado for monkeypox?
I don't think that, I'll give you general response. I think for patient privacy, there hasn't been a lot released, but over the course of the hospitalization and emergency visits nationally, pain has been a big reason. Pain management. These lesions hurt. And if they are occurring in sensitive areas of the genitalia region, infection around your anus. They're painful, and so pain management has been a big deal and has prompted use of hospital services, whether on the outpatient or inpatient. Ocular infection, so if monkeypox is eye, it can actually be called scarring, and there's a risk of sight. It's actually a very serious infection, and so that will prompt hospitalization. TPOX can be taken orally, or it can be given IV. So depending on the circumstance and depending on the ability of someone to be able to swallow pills and so forth, may also influence hospitalization. The pain management has been a big issue with individuals who've been hospitalized. But I can't say specifically for the state of Colorado.
Thank you.
Question?
If I could, Mr. President. Hey, thank you, Doctor. This is Councilman Dave Donaldson. I'm going to follow Dr. Vu's lead, and I think I have 3 questions. So on page 18 or slide 18, there's a bullet there about possibly touching objects, fabrics, surfaces. Have there been any confirmed cases transmitted in that fashion?
This risk came from experience with previous monkeypox cases. So this monkeypox virus was identified in the 1950s, began causing outbreaks of disease in Western and Central Africa in the 1970s, and mostly to exposure to infected animals. And so there is, and then we had some sporadic cases in the United States and the UK. I forget my dates, I think in the 70s, I'm sorry, in the 80s and 90s. I'll get back to you on the dates, but, and there was a report of a healthcare provider who had acquired monkeypox, and speculation had to do with investigation that they had gone into the patient after the patient had left and sort of shaken out linen in the patient exam room, and that was a investigation. The results of the investigation surmised that might have been the most likely mechanism of transmission. Now, in other geographic regions, there may be crowded housing and so forth, there may be more opportunities for this type of transmission. But in this current outbreak that is associated with sexual activity of various types, that appears to be the most, that skin-to-skin contact, direct contact with lesions appears to be the most prominent method of treatment. That said, when we have a case of monkeypox, provide guidance and advice about cleaning, environmental cleaning, and cleaning of linen and towels and so forth, so that we avoid the possibility of what we call full-night transmission.
Okay, so it's a prudent step to follow those precautions, but there's one historical possible case that was transmitted that way from perhaps decades ago, and then in extremely crowded conditions, there's also some thought, but we don't really have a absolutely confirmed case like that. But I appreciate, hey, we want to be cautious and take the prudent steps. Question number 2, and I may have just missed this. No, ma'am, you go ahead.
I was going to say, I think the data from U.S. investigations is very provisional. Every couple of weeks we learn more, so I think like skin-to-skin contact appears to be the most
okay. And then my second question, the vaccine, I think you covered this, but I just want to clarify it for myself. Really, we're finding out now if this vaccine is going to be effective or not. Is that correct? We don't know. Yeah.
The laboratory data would indicate that it should be, but this is a large national outbreak now. There's almost 60,000 cases in the United States, and 3 or 4 times that internationally. So we are learning, and we are trying to take a tool that, at least based on laboratory data, we would expect to have some efficacy in the field. Because this vaccine has been study for the purpose of smallpox and has been used in clinical trials for the purpose of smallpox. So we understand we have a good safety profile, but being able to roll that out as a prevention measure and then, well, just like we did with two COVID vaccines, right? Roll them out, start measuring vaccine efficacy.
Okay, and final question. It seems even from the numbers in Colorado that this is a disease of homosexual, bisexual men at about 90% rate with multiple partners. Is that characterization, would you say that's roughly correct?
So thank you for that question. I might rework that a little bit. The persons that are at highest risk are persons who have sex, who are men who have sex with other men, acknowledging that there is, anyone who has skin-to-skin contact with someone with monkeypox can get monkeypox. So let's try to make that clear. When we do investigations, we are concerned about sexual partners, we're concerned about household members, we're concerned about household members of any age. Because depending on where the rash is, some people have rash on their hands or their arms or on their face, where there is opportunity for skin-to-skin contact. So anyone who has close, prolonged skin-to-skin contact with someone with monkeypox rash can get infected.
Mm-hmm.
Taken with that, the persons in the highest risk group are likely to be exposed to sexual activity, and it is among gay, bisexual, other men with sex with men, but also other persons of different genders or sexual orientations who also may involve sexual activity in someone who has monkeypox.
Okay, because what's striking or what jumps out is heterosexual individuals also have skin-to-skin contact when they have sex, but this is a very low rate among that group.
I think there's opportunities and choices of sexual partners and where that mixed group may be. And in Colorado, 8.5% of cases have occurred among persons identifying as heterosexual, 11% of cases occurring among persons identifying as bisexual. So I think it's hence encouraging anyone who may be outside of a mutually monogamous relationship asking about rationalism of their partner.
I won't ask that question. I think that's good for me. Thank you for the information.
Thank you. Dr. Vu, did you have something else?
Actually, yes, can I just have a comment? I think, Dr. Albanese, I think in my mind I would classify this monkeypox as a disease that is transmitted by skin-to-skin contact, and perhaps through surfaces, and behaviors of individuals may increase or decrease the risk of transmission.
Any other board member questions yet? Archie?
Just one question for you, and that is, those of us who are older, you mentioned people with gray hair, some of us don't have hair, but we have a scar on our shoulder. Does that immunization provide any effect against monkeypox?
It's an excellent question, and that has come up a lot on the national discussion. I think the concern is if your scarification, so that's when you use what's called a bifurcated needle that sort of just implants the vaccine virus into the skin on your shoulders. Those who received it decades ago, there are persons who are getting monkeypox infection now, who have the smallpox vaccine scar or recall receiving the vaccine many, many decades ago. So it's expected that long period of time, the original childhood or a smallpox vaccination, for example, and now it's just too great for the immune response to be activated enough upon exposure to monkeypox. There is a study underway, I think through the NIH, among persons who may have received smallpox vaccine or a booster a couple of decades ago.
God.
So in the early 2000s, as just sort of part of the general response to concerns about smallpox as a bioterrorist agent, those individuals are being studied now see about their response to the vaccine, see if they get a nice boost. The NAV vaccine is given in 2 doses, 28 days apart. So whether just giving those individuals 1 dose might be sufficient in response and so forth. But if someone would still receive, someone has an exposure to monkeypox, so met the criteria for receiving vaccine, they would still receive the NAV vaccine despite a past history of smallpox vaccine.
Thank you. Okay, Director Whelan?
A couple more things. So thank you, Dr. Albanese. I just wanted to state, if it's not clear already, that this is not a sexually transmitted disease. It's a communicable disease that can be transmitted through sexual contact. Wanted to sum that up because I think that there is a lot of information out there that's being filtered, and want to make sure that we provide direct information to the best of our knowledge as we continue to learn. So thank you, Dr. Albanese, and we'll continue to have updates on the monkeypox situation as it evolves. I wanted to say that we're at time, so Alicia, if you just want to stand up, she was going to provide a COVID update on response. I do want to thank her for her leadership in the COVID response because she is the one that has been leading the team as we've been transitioning to high-intensity COVID with all of the efforts and the response that she's been involved in. And we'll email that information out to everyone. The good news is that we have been in contact with numerous partners, congregate settings, businesses, and such that we connect with on a routine basis. So those folks have the information, but you do have some of the changes in the response efforts in your packet, and we will send that information out, and it's also on our website, and so for members of the public, you're welcome to get that information there as well. One more thing, too, I wanted to get in, and we'll provide many more updates on this, and if Dave Donaldson, do you have a COVID question?
It's actually, as I thought about what you said about a communicable disease that can be transmitted by sexual contact, do we have another example of a communicable disease which is 90% prevalent only in, say, the homosexual, bisexual population, or that is only if found at that high a percentage in a sexual group? Because, I mean, a communicable disease would be something like the flu, but we don't find it only in a certain group or at 90% rates. So I just think that might be something of a mischaracterization.
Can I address that?
Please.
Yes. This is new here in the United States. It's new in the rest of the world, but it's old in Africa. And there's plenty of information, plenty of data and experience in Africa with this illness. So I think we have to give it some time. I think we have to do our studies, let the communicable disease experts work on this and find out exactly which groups are most at risk. How we characterize it at this point, it's a communicable disease. It can be transmitted sexually. And so I think that is a fair statement, and I don't see a problem with that.
Do you understand my question, though, how that's a little bit odd that it is very much being transmitted, found in through sexual activity? And I don't know that we have another disease that we call, hey, this is a communicable disease that is passed at that rate only through sexual activity, or we can call it skin-to-skin contact, but it's it's sexual activity. But so just my thought. I don't know if the doctor has a reply to that, but thank you for hearing the question.
I don't know if Dr. Mayer or Dr. Albanese wanted to comment further.
No.
Okay.
Okay.
Okay. So something of note that I just wanted to put out there, and there'll be more information on this as well. I attended the Attorney General's conference on opioids, where there was a settlement nationally, and the Colorado is also getting some distribution.
Excuse me, Commissioner Gonzalez was looking to make a comment virtually.
Okay.
Thanks. Yeah, I don't know why my audience coming in late, I guess. My question relates similar to what was just talked about. So how many, I assume there's been contact tracing done. So how many of the Colorado ones have been by casual contact or surface touching versus touching? Especially if they are sexual.
Dr. Albanese.
Dr. Albanese. Thank you, Commissioner Gonzalez. I think Dr. Albanese may have answered that. Yeah. Go ahead.
Yeah, so I think if you look at the sexual orientation on the slide, but 8% identifying as lesbian or gay, 11% bisexual, 8% heterosexual, and then 2% having a different term that we would even specify, about 10% unknown. The up to until very EDPHE is the sole public health entity investigations in monkeypox in Colorado. That is in transition to change, and the Paso County Public Health is going to be taking on that responsibility in very short term here, and probably by next week. So we don't have ready access to the contact investigation. Some report probable contact with sexual activity. There have been a handful of infections in women where it has been difficult to identify what the exposure were. Some persons either don't know or were just not able to sort out where the exposure occurred. So that is one of the reasons that we want the public to understand that if someone has an active monkeypox infection rash, there is virus in that rash region, and contact with that rash lesion, close to close, skin-to-skin contact with that lesion is a risk for getting exposed and infected.
Yes, Dr. Martin.
I may make one comment just to try to clarify. So if I give you a hug, I can't give you chlamydia, but I could give you monkeypox. And I think that's the point that Director Whalen was trying to make, that this is a disease that is spread, it can be spread through non-sexual contact, even though you're correct, the demographics currently support overwhelmingly sexual contact, but it's not an STI.
But you could give me herpes, right? With a hug.
Conceivably, yes. You
Okay,
could.
so that's the same as this, and we classify that as an STD.
Well,
But
yeah, I mean,
and I don't want to go, down a rabbit hole with a word, but I expressed my question. I appreciate hearing me out. Thank you.
Yeah. So.
Well, and we'll provide further updates as we learn, as Dr. Albanese had mentioned, that it's there's emerging diseases that our community are dealing with, and some of that is that we're learning as we go, and we're collecting the data. My point was mainly that it can be spread by communicably, and it's definitely not going to be spread, me walking past you like in a grocery store or something like that. But my point is that it's much more than just sexual partners. And so I'm just trying to provide more insight and information related to some of the filtered information that sometimes I'm viewing or seeing, and trying to keep it in context. And I think that your questions are helpful also for providing that context, because I think that that's where our responsibility lies, related to what we know, when we know it, and how we present it, then working through getting that information directly. So I think, Commissioner Gonzalez's questions, your questions, and Mrs. Ralston's and Dr. Vu's too, I mean, they're all really important as this situation evolves.
Any other board member questions or comments?
I have a quick question onto the COVID-19. There's a number of vaccines put out by Moderna, J&J, and the latest I hear is Novavax. have there been any data as to which one is more effective than others, and also the side effects? I heard that J&J is more prone to blood clots and things like that. Do we have any data in those regards as to which one have stronger efficacy and which ones have side effects and things like that? Haven't heard a lot on.
We can have, Dr. Mayer or Dr. Albanese come up, and then we can also, provide a presentation in the future. I think that, what's on our radar also is that there'll be the bivalent vaccine that we're able to order for the fall. That'll be coming soon, and we'll provide much more information on that.
Yeah, overall, the mRNA vaccines are more effective. Yeah, that is true. Pfizer and Moderna are more effective.
Okay.
Yeah, for sure. And then bivalent vaccines, we don't have a lot of current data on the new ones that are going to be released in the fall. The one that came out in the UK was a BA1 specific bivalent vaccine, and even that one did show 1.6 times the antibody levels of the previous vaccine for BA4 and 5, so that's encouraging. But as far as data for what we're going to get in the United States in September, that's not out yet.
We don't know yet.
Okay.
But at our next meeting, bivalent vaccine is going to be front and center. It's already great for that.
Mm-hmm.
Vaccine, and they need to go through the same approval process as the vaccine. So the pharmaceutical companies manufacturer will be linked to the FDA, and it's going to be very much about antibody response to the vaccine. Limited real-time data about injecting this person and measuring the COVID after infection. And if the FDA approves authorization, advisory commission practices for the ACIP, they will set the guidance for clinical use and approve this vaccine. So we're hoping that sometime in September it will all come together. So yeah, hopefully
Thank you. Yeah, that's a good question and a big question.
Can I make a small comment? I think in general, the most effective vaccine is the vaccine that you can get into your body for the appropriate indication.
So I just have 1 minute more of an update related to opioids and fentanyl, because that has been a big topic, and we'll continue to work on that. As you know, there was a settlement nationwide, and then Colorado has formed a opioid abatement council, which then relates to us locals, and we are Region 16, and we are included with Region 16, which includes Teller County and El Paso County. That group is newly formed, and we have Commissioners Lojinos Gonzalez, our board of health member on there. We also have Commissioner Carrie Geithner on there, as well as numerous different municipalities, leads, and it's pretty vast and thoughtful related to how that is organized in law enforcement and the district attorney. And Stephanie Finley Fortune, who is a city, Colorado of your counterpart, Colorado Springs City Council woman. She is the chair of that opioid council. The opioid council for El Paso County and Teller Council, they are voting members, and that also includes like the coroner's office and some others that I did not mention. Then there's an advisory committee, and public health has a seat on the advisory committee, as well as numerous others to provide that technical guidance, and then also that input with the opioid council. As the opioid council, we consider the funds that are being distributed to Region 16 is just over $28 million. And those funds will be utilized over, it's anticipated for the next 18 years. And those funds were mentioned in the the Attorney General's conference and as Exhibit A, and I think that this is a really good document that we're going to refer to, and what Exhibit A is what are the approved uses of funding for the opioid prevention efforts, and those go to treatment of opioid use disorder and its effects, intervention, criminal justice, involved persons, women who are pregnant or who may become pregnant, people in treatment and recovery, and then also the bucket that is public health is prevention, which includes prescribing practices, as well as some of our efforts in primary prevention with communities that care and some of our ongoing efforts. So I wanted to mention that because I do think that that is extremely significant to Region 16 that we all need to keep updated. There are applications for advisory members to serve on the council. These are open meetings that happen every month, and they're newly forming. But I do want you to know that you're welcome to join us and get involved, because this is a significant problem, throughout all ages, demographics in our community, and this is another effort that we're going to need to work together to create some action plans and then get behind that and do the evaluation and continue going from there.
Thank you, Director Whelan. Any last questions, comments from board members? No? Okay, the next Board of Health meeting is scheduled to take place Wednesday, September 28th, 8:30 in the morning. Welcome especially to our new staff, and farewell, Lisa Powell. We'll miss you. And I would entertain a motion to adjourn.
Second.
All in favor? There we go.